We've been hearing a lot about cancer, and the next mini majority route to cancer is death.
Is cancer a death sentence? Not all cancers. People that come extremely late, then many a times there's little that we can do for them.
Okay, so which means that early detection is very, very important.
Very.
I know we have different types of cancer, but what are the common, like generally, that people can just see and think, oh, I'm having something, let me quickly get this thing done?
So the fact that it's painless, if they notice a lump and it doesn't pain them, so just leave it. Say, at least it's not bothering me.
What are the types of cancer that are very, very common in Nigeria?
In our clinic, we see maybe 30 new patients or let's say 20 new patients on a clinic day. We see maybe about 50 to 60% of them are breast cancer.
But now for cancer, it is scary. Do we have anything, like something to prevent ourselves from? Like, what are the preventive measures?
Alcohol intake, reduce it as much as possible. You can avoid it, it's very good. All right, smoking of cigarettes, marijuana, those things actually contain things that could actually cause cancer. All right, we call them carcinogens.
So I'm here with Dr. Ademola Oyekan. He's a consultant in radiation and clinical oncology at LASUTH. We've been hearing a lot about cancer, and the next mini majority route to cancer is death. If you have cancer, that is the end of life. I don't know much about that because I'm not a specialist, but I have a specialist here that can give us, perfect answer to everything we need to know. And he is Dr. Ademola Oyekan. Dr. Ademola Oyekan, thank you very much for sacrificing your precious time to attend to us and also to the masses. I have some few questions here to ask, and I know you can do justice to it. So number one is, for someone who has never really understood cancer, how would you explain it in a very simple term?
So cancer cells are abnormal group of cells or tissues that acquire the ability to divide uncontrollably.
Okay.
And then they do not respond to a stop signal that tells them to stop when they are dividing. So they divide uncontrollably, and they've lost that ability to put a stop on it, and that's what makes them cancerous. They do not just grow, increase in size, they occupy space, and they also infiltrate other organs surrounding that tissue where it's dividing. So basically, that's what cancer cells have.
All right, thank you very much. And I know, as I said earlier, many people believe that cancer is death. Is that true? Is there any process of treatment that people can really survive cancer?
Yeah, so basically, I would say that cancer is not a death sentence. Number one, many cancers are actually preventable with screening, with vaccines and all that. There are different levels of screening, prevention that we can accommodate or approach. The primary level of prevention, where we're doing this awareness. The secondary level, where we're doing screening. Part of the primary level is also vaccination. And then vaccination, there's HPV vaccine that is available for cervical cancer. There are countries of the world where the number of patients that they have that develop cervical cancer is very small compared to what we have here, where people still die of cervical cancer here in Nigeria. And there is vaccines against hepatitis B infection that predispose people to liver cancer and things around the liver. Yeah. So there's vaccine for it. Those things are preventable. Wow. And if people are aware, they're able to take these vaccines, go through screening, it can be prevented. Is cancer a death sentence? Not all cancers. So For some cancers, it can be, if it is caught early,
Okay.
it can be cured. Things like breast cancer. We have had people that have had breast cancer, and you would never really know unless they tell you. All right. So breast cancer, testicular cancer, cervical cancer can be cured. All right. Colon cancer can be cured if it is picked early. But if it is not picked early, people come in advanced stage, then you may not really be able to talk about so much of cure. We're talking about management.
Yeah.
All right. And people that come extremely late, then many a times there's little that we can do for them.
Okay. So which means that early detection is very, very important.
Very.
Just like when it is important for you to check do your breast examination, should in case there's any lumps or this
Correct.
thing. So that means that it could be curable, or it is curable if the early detection is in place. Okay.
Correct.
Okay. Thank you, sir. So another thing is, what are some common warning signs of cancer that people often ignore? I know we have different types of cancer, but what are the common, like generally, that people can just see and think, oh, I'm having something, let me quickly get this thing done?
Well, basically, we cannot put all these common signs together, but the thing that is common to most of them is loss of weight. All right. Loss of weight for a long time. I mean, somebody keeps losing weight over a period of time, and is not intended weight
To
loss.
lose weight, okay.
All right. So unintentional weight loss is a serious warning sign. For some cancers that, like breast, if you notice a lump, any part of the body apart from the breast, you should speak out. It may not really be cancer. It may just be a lump that's maybe on the skin that we call lipoma.
Yes.
That's a small, a benign tumor that arrives. Things that makes it difficult for people to go on to check for breast cancer lump is the fact that most often time it's not painful. So the fact that it's painless, if they notice a lump and it doesn't pain them, they just leave it. Say, at least it's not bothering me. All right. And that painlessness makes people careless about it. So it does not mean that all breast cancer, all breast lumps that is painless is cancerous. All right. And it's not also the other way around, that if it's painful, it means it's not breast cancer.
Okay.
So it can be painless or painful, but most of the time it's painless. All right. And if people notice things like that and they don't really pay attention, just go on to the hospital, let them check it out, see a proper doctor. Many a times, I mean, I like the community lifestyle that we have in Nigeria, where we're able to tell this person that, oh, this is what is going on. But many a times you get the wrong advice from people that really love you, but they don't have better information for you apart from what they know. So it's better when you have complaints like that. It's important to go in to hospital, get it checked. All right, let them do, even if it is a scan or a mammogram, let them get it checked. All right, basically that's what I would say for now.
Okay, thank you so much. Here in Nigeria, I want to ask, what are the types of cancer that are very, very common in Nigeria? With your level of expertise, I know you have worked here for a very long year. So what are the common cancer here in Nigeria?
So basically, there is a breast cancer, which is common. Actually takes the majority of the population that we have. In our clinic, if we see maybe 30 new patients or let's say 20 new patients on a clinic, they will see maybe about 50 to 60% of them are breast cancer. The other things are prostate cancer, colon cancer, and maybe cancer of the liver and all that, and the lungs.
Okay. And let me just say this is the last one, because
cervical cancer, yes.
Cervical cancer,
very
yes,
important. Cervical cancer,
yeah.
Cancer of the womb.
Okay.
Yeah.
So I don't want to waste much time, because I know you're a very busy person. But I have this question. If you don't want to have STI, you know the prevention, this thing that you have to stay away from unprotected sex, and if you don't want to have HIV, don't use sharp object and all. There are prevention, method for you to prevent yourself for some diseases. But now for cancer, it is scary. Do we have anything like something to prevent ourselves for? Like, what are the prevention and preventive measures? And that is the right word.
So prevention is actually is a holistic thing. Everybody has a role.
Yeah.
We have a role. The doctors have a role. The government have a role. The community in general has a role. So for the individuals, their role is, to avoid the risk factors, the things that are known risk factors for cancers, like alcohol intake, reduce it as much as possible. You can avoid it, it's very
Yes.
good. All right. Smoking of cigarettes, marijuana, those things actually contain um, um, things that could actually cause cancer. All right. We call them carcinogens. All right. So the lifestyle that I mean, for us in Lagos is a busy place. Stress would actually depress your immune system, all right? And although it's not proven, all right, but when your immune system is down, then your defense is down. Cells that are growing abnormally that your defense is supposed to
We have the
take care
chances
of
to
will
do
have
it.
chance to thrive, all right? So basically, stress could trigger some things, and then from there things happen. Then there are some infections that we've mentioned, HPV infection,
HPV
that is a
infection.
sexually transmitted infection.
Yes.
So it can actually be prevented. All right. Hepatitis can be prevented. If you take HPV vaccine, all right, it reduces your chances as much as possible to cervical cancer. So you may not really be able to prevent all the cancers, but any cancer that is related with HPV infection, like the cancers of the head and neck, all right, it can also prevent it. All right. So things like that. Then the lifestyle, sedentary lifestyle, which is now common. We're adopting the Western lifestyle where everybody now owns a car and everybody drives 4 or 5 hours from one place to the other almost every day. And then you eat fast foods, highly fatty, and all that. Things that will not allow your system to actually move. Food that will be slow to digest. Those are things that actually trigger some of these things, like colon cancer. You eat rice in the morning, jollof rice in the afternoon, then you eat maybe semo at night. You are just taking a lot of carbs with less vegetables and fiber, no fruits. Those things can actually increase
the risks.
slow down the momentum that's at which your bowel is moving, and then a lot of things can start coming up from there. There are sometimes that there are risk factors that we cannot even prevent, can't do anything about, like increasing age. Somebody cannot grow younger,
Yeah,
so you are
definitely.
growing older. So that you can't do anything about. Heredity, you can't do much about it. Genetics, you can't do much about it. All right. So for the things that we can do something about, our lifestyle, what we do, habits, here and there. And there are some cancers that are just, basically sexually transmitted. If you can avoid all those things,
It's fine.
it will help a lot, all right, in reducing the risk.
Okay, thank you, sir. So, second to the last, actually, what are the simple screening tests someone should go for early detection? Ideally, generally, we used to advise this liver function test, EUCR, kidney function test, then lipid profile, lipid panel. But what are the tests that someone can go for early detection of cancer?
So not all cancers have screening modalities, all right? So, but what is done is that for the common ones, there are screening modalities available. So like for breast cancer, if you're younger than 40, and there's a family history of cancer or breast cancer in the family, all right? So person can go for a breast ultrasound scan or a mammogram. I mean, a breast MRI, sorry. Then if you are over 40, you can do a mammogram, all right? You can do that once in a year or two, all right, just to check. But your own self-breast examination will go a long way. And you are taking your bath with soap in your hand, you can just take it around clockwise, anti-clockwise, check the breast when you are not menstruating or when you are not ovulating as a woman, all right? That's for breast cancer. For cervical cancer, there is pap smear, all right? Apart from the vaccination that is available in terms of prevention, there's screening modality that is called pap smear, where you can do once every 3 years to find out, especially for those that are sexually active, whether they have any early signs of cervical cancer. And there is also an improved test that can be done where you do pap smear with HPV DNA. And that is done once every 5 years. So instead of doing pap smear every 3 years, you can do that HPV DNA once every 5 years. And if they find out that you have the HPV DNA, they can give you a short-term visit to come back to recheck whether the HPV is still active or it has cleared. All right, that's for cervical cancer. Now for people with, to screen for liver cancer, they do alpha fetoprotein, a test that is called alpha fetoprotein, and abdominal ultrasound scan or a CT scan. It is done in a particular group of people with that already have hepatitis B infection, whether especially in the chronic ones, the ones that have had it and they've gone through the symptoms and there's nothing again. So they can be going for that screening from time to time to know whether there's activity going on in the liver, whether there's transformation of cells in the liver into cancerous cells. That's for cancer of the liver. For colon cancer, they can do what we call colonoscopy, where you can check that once every 5 years, all right, or once every 10 years. And for people that have family history, they can do it once every 3 years. There's also fecal occult blood testing. If you are afraid of them sticking a tube or a pipe through your anus, you can do a fecal occult blood test. At least it can give us an idea, it can give us a cue. And they're using even a more developed test that is called FIT. That is fecal immunohistochemistry test, where you can actually take this tool and do some DNA testing on it to find out what kind of cells are there. So basically, for prostate cancer, the PSA is there to do, all right, and then digital examination by your doctor. So these are the common cancers that are bound, and then those are the basic screening modalities.
Okay. So thank you very much, Dr. Ademola Oyekan. Thank you for your time. I know this is a full consultation, because consultation is actually free, but it will really help people to get more knowledge about cancer. And I'm very sure with this session with you, people will get to know that cancer is not a death sentence, and they can actually seek help from their specialist. So thank you very much for your time.
Yeah,
thanks so much.